Inguinal hernias. Okay, so in inguinal hernias, what occurs is the protrusion of abdominal viscera. So abdominal viscera, they protrude like loops of intestine as pear shaped. It protrudes out from the abdominal viscera. Now there is direct inguinal hernia and indirect inguinal hernia. Direct inguinal hernia, it enters the inguinal triangle. Okay, it occurs through inguinal triangle. Whereas indirect, it enters through the deep inguinal ring. That is, this loop or protrusion, it occurs through the deep inguinal ring. This occurs through the inguinal triangle, and this is common in elderly, and it is of two types, medial and lateral. Whereas this is generally common in children and young adults. Okay, and it is generally scrotal. This is not scrotal. Okay, generally not scrotal. This is generally scrotal, and it is a oblique course, whereas this has a straight course. Okay, this has a straight course. This has an oblique course, and it is of two types, congenital and acquired. This is medial and lateral. Now congenital and acquired. Congenital, if the processus vaginalis remnants are actually proliferating, they are present, they are not present as remnant, they are present as such, then it can cause congenital indirect inguinal hernia. Acquired, when intra-abdominal pressure increases too much, then herniation, okay, that is acquired. Okay, now medial and lateral is there. The main reason is that, see, this is on the basis of the medial lateral border, which is inferior epigastric artery. Okay, basis of the inferior epigastric artery. Now if the hernia is coming out from the medial border, this is the medial border, suppose if it is coming out from the medial border, then it is medial direct hernia. If it is coming from the lateral border of this what is this inferior epigastric artery, then it is lateral inguinal hernia. Okay, now the inguinal hernias, they only occur in men, not in other mammals. So there are many mammals, they only occur in men, and they are most commonly in males. And femoral hernia, as you can see, it is more common as fem, so it is more common in females. And I have told you to remember in inguinal rings that it is medial to pubic tubercle, the inguinal hernias, whereas the femoral hernia, they are lateral to the pubic tubercle. Okay, what? Yes, did I tell you the opposite things? No, I think I told you the same thing. So in inguinal hernias, it is medial to the pubic tubercle and it is lateral to the pubic tubercle. I hope I have told you this right order. Okay, now the coverings, which I know I have drawn very much, have written so haphazard manner, but I'm sorry. Indirect, you need to remember the coverings from outside to inside when protrusion occurs: skin, external spermatic fascia, cremasteric fascia, internal spermatic fascia, and extraperitoneal fascia. Simple. Skin, external spermatic fascia, cremasteric fascia, internal spermatic fascia, and the tissue, extraperitoneal fascia. Whereas in case of direct, now there are two types of direct inguinal hernia: medial and lateral. So it depends according to that. So there is skin, of course, then comes external spermatic fascia, then comes conjoint tendon and cremasteric fascia. Now conjoint tendon comes under medial and cremasteric fascia comes under lateral. So conjoint tendon comes under medial. Okay, whereas in lateral, cremasteric fascia comes. And then instead of internal spermatic fascia, we have directly fascia transversalis. What we have? We have fascia transversalis, and then we have extraperitoneal tissue. So this is how you will learn the coverings. If inguinal hernia comes as an essay, then this would definitely be asked. Okay, thank you.